Hi, I'm Bri Allison with the National Library of Patient Rights and Advocacy, and welcome to our segment, Tell Us Your Story. Today we are joined by Ms. Kelly Tuttle. Kelly is a neurology nurse practitioner who has been on a journey of self-rediscovery after her traumatic brain injury in 2015. Since then, she has made it her mission to offer help and hope in her book, After the Crash. Kelly outlines strategic steps to help other traumatic brain injury survivors to keep working, learning, and living life as their brain and body heal. Kelly, welcome and thank you so much for joining us today.
Thank you for having me. I'm excited to be here.
We're excited to learn more about you and your traumatic brain injury. So, to begin, can you talk about what events led to your traumatic brain injury?
Sure. It was in 2015. I was driving home from work down a somewhat rural road, and unfortunately, a teenage driver pulled out suddenly in front of me, and I hit her.
Oh my goodness.
And I didn't realize there was anything wrong for quite a while. I thought I was just going to shake the crash off and go on with life.
So, did you have any physical injuries, or it was just kind of afterward mentally you realized that something wasn't right?
Yeah, that's a good question to highlight. So yeah, I had, of course, neck pain. I had hit my forehead, so I had a bruise here. My right arm was quite painful because the airbag had burned the skin
Oh,
as it exploded. And then, of course, the chest, a lot of chest discomfort from the impact of the airbags too. And then some right leg and knee hip discomfort because of slamming on my brake and then taking on that impact. So yeah, various injuries that you would commonly see with someone in a car accident. Yeah.
mm-hmm. And how did you kind of start to realize that something wasn't right?
It wasn't really until about 3 months later. And I have a couple of thoughts about that. Because I think that I was just trying to get back into life. I was trying to keep going to work. I was studying martial arts and preparing for my third degree black belt in karate and my purple belt in Brazilian Jiu Jitsu. So I just wanted to shake off the crash, get back to all that fun stuff. And I kept pushing it and failing and just getting worse and worse and worse. And then it was about that time that some of the cognitive stuff was, I was becoming more aware of it. I think I lost a lot of self-awareness initially after the car accident, and that self-awareness came back about 3 months afterwards also.
Mm-hmm.
I think that's why I was kind of blind to what was really going on with me. But fortunately, I had friends and family around me that were like, there's something wrong. You need to get care. You need to get care. And I listened and did seek care after about, I pushed more strongly for more care about that 3 month period.
And so after you kind of went to get some help, what did your recovery look like after finding out about your traumatic brain injury and what type of challenges did you face?
Most I'll, I had several common symptoms after a brain injury, which is neurocognitive fatigue, which and physical fatigue. And then I had headaches. I had headaches almost every day for about 4 years after the car accident.
Oh, wow.
I still struggle with the fatigue. Initially, with my fatigue, I was sleeping 12 to 14 hours a day with a 2 hour nap. And eventually, as the years passed, that became 12 hours, then 10 hours a night. And now I'm about 8.5 to 9 hours of sleep at night without a nap. Yay! So a lot longer than I had thought and planned. And every year it gets better, which is I'm really grateful for.
Great. And what kind of help from doctors and different things did you get after your traumatic brain injury?
Initially I was kind of left to my own devices. I'd seen my primary care provider, my general practitioner, and then went back when I wasn't better that 3-month period. And she felt I had anxiety. She sent me to mental health, and that was not where I needed to be. Even the counselor agreed that my symptoms were related to a concussion. And then one day I was out having lunch with one of my colleagues. She at the time was a neurology nurse practitioner. I was a cardiology nurse practitioner.
Mm.
And she was really interested. She wanted to know how I was doing and progressing, because she knew that sometimes it can take a while. And I told her about an incident of falling asleep at the wheel on my way home from work. And she was like, and I at the time was like, well, I did. So I guess now I just have to take a nap in between driving from work to home. See, there's no self-awareness there.
Yeah.
Crazy. And I mean, who thinks that's okay to just close your eyes while you're driving for a second? No one thinks that way. But I did. And my friend was like, that's not good. That means you need to get care. And what care have you gotten? And I told her exactly what I just said. And she goes, oh, no. You need to see a physical medicine rehab physician. And I was like, what's that? And it turns out they're the doctors that help people with traumatic brain injuries and strokes. And so I went back to my primary. I had to request a head CT. At that time, I had not had a head CT yet. And then get the referral, which both the neurologist and the primary provider were really reluctant in providing me. But I got it. And then I had the appointment with the physical medicine rehab doctor. They used to be called physiatrists in the past. And she was the first provider that was like, oh, yeah, you've had a concussion. It looks like you possibly have diffused axon shearing, which happens when the axons, the cell's communication cables, are torn and no longer connected. And from the point of seeing her, I finally went onto the right road of recovery. And she took me off work for 3 months, which allowed me to rest, recover, and kind of build up my strength to return back to work. I went to a speech therapist who helped me develop compensatory tools and strategies to help me at work, and physical therapy to help me with my my neck to heal, and a neurophysical therapist who was able to tell me the reason why I had headaches and nausea was because my brain wasn't tolerating tracking moving objects. So that was really helpful to know too. And then, I eventually was referred out by my car accident lawyer to specialists because I wasn't getting better. And it was 4 years later, in 2019, I still wasn't better. So he sent me to a neurobehavioralist specializing in a different MRI that is called a functional MRI, which is not normally used in practice. And I did have a T3 MRI done, which is used in clinical practice in outpatient care. But it didn't show too much. It did show some copper staining, which is consistent with blood cells being broken. And the functional MRI, though, showed a lot more. It showed the diffuse axon shearing. It showed changes in the size in the ventricles of my brain. So it was really helpful in documenting that, there was a brain injury, because the whole time you're kind of thinking, oh, am I crazy? My head CT was normal. My other MRI was normal. What is wrong with me? Why can't I think straight or talk straight? So that was really helpful for me. And then he referred me to a specialist to have my vision evaluated for binocular vision dysfunction. And that's when your eyes just don't work well together. And with a little tweak in your glasses, like a prism type glass, it helps the eyes function better so you can see better. And you use a lot less brain injury to brain energy to see with reading, computer work, watching the television. It helps with that difficulty with tracking objects, moving objects. And it helped with my neck pain because in order for me to see straight, I was tilting my head to the right. And so then I didn't have to tilt my head to the right, and that my neck pain finally healed. I had more energy, was able to work longer and study and read longer. So it was a big, that had a big impact on my recovery. And then they also did a sound sensitivity survey and found that I was sensitive to sounds. And at that time, recommended noise canceling technology with earbuds and headphones, which was fantastic because I was really sound sensitive and didn't really notice it, and that it was affecting my concentration and my focus, which was further making me feel exhausted by the end of the day. So these little tools, techniques, and strategies were allowing me to work longer and then finish work without having to go home and take a 2-hour nap. So those were the things that helped out a lot.
Well, it's great that you had this friend, this neurology practitioner friend that could kind of help you lead you to the right path and kind of figure out the right things that worked for you. And I'm sure it was very frustrating, like having all of these problems, kind of understanding them and realizing them, but then having some doctors not really help you recognize them. So it's great that you found people that were there to help you and help you understand your traumatic brain injury and kind of get you on the right path to recovery.
Right. I think if it hadn't been for the help and these people surrounding me to support me, that this would have been a different story, that I would have
Mm-hmm.
lost my job and my home, maybe my marriage. And I know that happens to some individuals because they do not know who to go to get the care. And then after my car accident 2 years later, I was able to work and study and get a job in neurology. And as a neurology nurse practitioner, I was interacting with patients with kind of similar stories, just not knowing where and who to go to. And so that's why I ended up writing my book. My book's focus is, like you know, the title says, is to help people who are recovering from a concussion or a brain injury to keep working and studying and get through life while they're waiting for their brain to heal. And in that book, I talk about various symptoms that you can have after a traumatic brain injury and which specialist to go to with those symptoms.
And that's perfect because you needed that person in your life, and now you can be that person for other people.
Boy, I
Um,
hope so.
oh, I'm sure that you are. And going on that path, talking about being a neurology nurse practitioner, how did your traumatic brain injury give you insight into how to interact with these patients?
It's been actually a great gift because when I take care of patients with Parkinson's, multiple sclerosis, epilepsy, brain injuries, and stroke. And a lot of those patients have common symptoms like cognitive fatigue, difficulty with word finding and memory. And so I was able to relate to them and say, yeah, I get that. I know what you're talking about. It's like this, and this. And they're like, yeah, how do you know that? And for a long time, I did hide my disability from my employer and from my patients because I was worried that I would be seen as not competent if I allowed that information out. But after I wrote the book, then I was like, oh, forget it. Everyone knows now. But
So,
yeah, it was definitely it definitely helped me to have um, more understanding and empathy, and I was able to find the words that they were not able to say to
mhm.
put to the symptoms that they were struggling. So yeah, it has been helpful to be a traumatic brain injury survivor in helping patients with taking care of their brains.
I'm sure you make them feel very heard in their symptoms and what they're going through. So it's kind of nice probably to have somebody that kind of has a similar understanding and kind of go on this path together. So you kind of started talking about your book a little bit, but can you talk about what someone expects to happen with their body and mind after they have a traumatic brain injury?
Well, there's no linear way for recovery. Everyone's recovery is very different. Some people will recover from a concussion within a couple weeks to a month, but a small percentage of people do end up having symptoms that persist for a lot longer. I usually tell my patients, you'll see, you may feel better in 6 months. It may take up to 2 years. If it goes beyond the 2 years, do not lose hope, because as the years pass, there will be more and more improvement. It's just more subtle and more spread out
Mhm.
than initially that within that first 2 years. And the other thing too is to know that, and I often recommend to my patients to journal their symptoms, because as you're healing, your symptoms can change. So, and what I have seen too in practice and with myself is as injuries such as neck pain or arm pain, or, if they dislocated their shoulder,
Mhm.
as those injuries heal, that's when other symptoms, especially the cognitive symptoms, start to appear. Because while there are usually, if you have really bad neck pain or you've broken an arm or a leg, you're going to be at home. You're not going to be using your brain at work, right? Or at school.
Mhm.
And then once you heal, that pain goes away. The injury is less of a focus for you. Then, and you're starting to get back into life, trying to use your brain at work or school. That's when you notice the other symptoms, like the difficulty with word finding or intolerance to reading off a computer or working under fluorescent lights, that kind of thing. So I always recommend start a journal right away, write down all your symptoms, recheck those symptoms every 3 months for the first 6 months, and then every 6 months after that, to see if anything has changed, anything is getting better, anything's getting worse. That way you can communicate better with your provider of what's going on and what you need.
Mhm. That's a very interesting perspective because I never really thought about you just kind of focus on the pain that's more physical and happening right away after you experience some type of traumatic injury, and then the cognitive parts comes in. So I feel like having a journal, like you said, is the perfect opportunity to kind of track everything so that as you go along this journey, it's best to talk to your provider about what has happened at the beginning and now where you're at when you go and seek help for your cognitive side of things.
Right. And then the one thing that I tell my readers and my patients is the great thing about your journal is when you have a chronic disease or a brain injury, it's hard, it's stressful, and it's sad,
Hmm.
because you are sitting trying to get better back to life while others around you are moving on with life. Life doesn't stop just because you're not feeling well, right?
Hmm.
So so when you're healing from your brain injury, you don't want to sit and be fearful or worry about the future. You also don't want to dwell on the things that you've lost in the past, but be in the present moment. But on those days that you're really bummed out and frustrated with your care, the journal is nice as a look back to see how far you've come.
Hmm.
And so one of my journal look backs was like, well, at the beginning, I couldn't make coffee and toast at the same time. If I made them at the same time, I would forget that I had the coffee or the toast. I would leave the toast in the toaster, sit on the couch and wonder why I was hungry. And then I would wonder, where did I put my coffee? And
Mm.
then, the end of the day, my husband would find a dried out piece of bread toaster. So and I have come a long way since those days. And so now I can look back and laugh, but I can also see that progress.
Hmm. And I'm sure that's very inspiring to keep going and face each day as it comes and just kind of watch yourself get better every day.
Yes, for sure.
And so, kind of leading into that, what tips do you have for somebody to kind of cope with their new normal after their traumatic brain injury?
Well, the first thing I would recommend is to, you've got to let go. If you've gotten to the point where your recovery is going into years, uh, you're it's going to be really important to let go of what you lost from your brain
Mm-hmm.
injury. For instance, mine was my unending energy. I was the battery, the bunny battery, the energizer bunny. And after my head injury, I'm more of a sloth. So there is some things that you will have to let go. And if you can't let go and move on and grieve those losses, um, then I would recommend getting help from either trusted friends or family, or a social worker, or a counselor, your psychiatrist. Because if you can't let go of the old, and then you're not going to get to know the new you.
Mm-hmm.
And that's what's important, is getting to know the new you and accepting your limitations and finding ways to work with them instead of against them.
Mm-hmm.
And the other thing is to make sure that your finances are in order. If your finances are not in order, you're not going to feel like being healthy and doing the right thing for your body or your brain. So really address your finances, because if you're missing work, that means lost income, and just kind of staying on track of that. And then if that's something that's too overwhelming, again, ask a trusted friend or family member to take over your bills. After getting a brain injury and it's looking like your recovery is going to be uncertain, you're not sure how long you're going to need to work part-time or be off of work, then you need to cut back on things that you don't need, that you may be paying for, until you're back to your full-time hours. One of the mistakes I made was paying for my karate classes when I wasn't able to go. And I paid for a couple of years
Mm-hmm.
without even going into class. And that was a lot of lost money. And so I would hope to impress on others to try to avoid those same mistakes that I made. The other thing is that you get very impulsive with your spending too. You can get very impulsive. I had that with myself. I had another patient that had some impulsive spending after her head injury. And so I shared with her, what you need to do is you need to put the credit cards away. You need to have your passwords changed on your PayPal and all that stuff to control that impulsive spending until you can conceptualize your budget and stay
Mm-hmm.
within that budget, and you're back to your work full time so that you can maintain that budget. So that's also an area that you want to avoid, that pothole.
And that's such great advice, because I feel like that's probably something that people don't think of right off the bat that might help them in this new normal that they're facing. But I feel like that's definitely something to keep track of, like you said, and pay attention to, so you kind of can keep putting your best foot forward with things. And you talked about having supportive friends and family. Now, if the survivor, doesn't ask for the help directly, how can the family and friends support their survivor through their recovery?
Well, one of the things that I definitely advocate for is to always go with to all the appointments of the survivors been scheduled for, because they're going to forget things. They may not really have the full perspective of their limitations. Like I said, they may not have that self-awareness.
Mm-hmm.
So my favorite thing is when my patients come to their appointments with a caregiver or advocate who I know is listening and is going to remember everything. And then when they go home, support the things that I say.
Mm-hmm.
So that would be number one. The other thing is to get in touch with your local support groups, your local traumatic brain injury support groups, because they're a great resource on finding out if there are support groups that you, the caregiver, can attend, and the traumatic brain injury survivor can attend to. They usually have them at the same time, and the caregiver goes into their own group and the traumatic brain injury survivor goes into their own group. And from those groups, they will put you in touch with local resources. And I attended support groups after my brain injury, and I learned about doctors in the area that specialized in traumatic brain injuries. So that can be really helpful
Hmm.
information that you can get from those individuals.
Yeah, you're just kind of building that community of people around you, which I feel like is definitely what you need when you're kind of processing and going through something traumatic and ever changing like an injury like that.
Yes, and there's a lot of resources out there with some really good information, but they're kind of all spread out. And so if you're doing it on your own, usually you don't have the energy to search on the internet and find that stuff. So another thing that a supportive friend or family member can do is to look for that information
Hmm.
for your survivor, and then read through it and then share the information in short little bits and bytes.
Definitely. The internet has a ton of information, so I'm sure it's helpful to kind of have somebody narrow things down for you and present it to you instead of trying to keep track of all of that yourself.
Exactly.
And so you kind of talked about this earlier with you had some doctors who were a little bit reluctant that you had a traumatic brain injury. So can you talk about how the healthcare system handles traumatic brain injury survivors and what advice you'd give to somebody who is looking for a healthcare provider?
So I think that the healthcare system has a very handles very well traumatic brain injuries that result in hospitalization, and then the person is transferred to rehab facility. I
Hmm.
think that component is definitely in place, but I find that outpatient care is where patients fall through the cracks, and it's kind of like people kind of go to the wrong provider for the wrong care. A lot of patients come to neurology, to me, with things that should be addressed by a different provider. And how I like to explain this to them, because they really just want a one shot, one stop provider, get all their care from the one person. And I tell them that the brain is really complex. And because it's so complex and has so many different parts, it really takes various specialists to come together and give you all the pieces so that you can have a puzzle put together.
Hmm.
So a, a lot of people think, well, I should see the neurologist. Well, actually neurologists help patients with brain diseases and not necessarily an injury. So it's the physiatrist that you want to see, the physical medicine rehab doctor. And then from there, it really depends on your symptoms, who you need to see. So if you're having those dizziness and visual issues, then you want to get referred to a neurotherapist. If you're having difficulty finding your words or concentrating at school, then you'll want a referral to speech therapy. If you're having vision issues, you'll want to, stop by your optometrist, make sure your eye acuity is okay. But then if they say everything's okay, then ask for the referral to an ophthalmologist to see if you have double vision, things that they can help you with. And if they're not able to help you or find anything, then look for a behavioral optometrist. And those specialists, they're a little bit fewer and far in between, but they're the ones that also specialize in brain injuries that affect the vision and how well the eyes and the brain work together.
Hmm.
So there's various specialists. It's just kind of getting to the right specialists. And the other key thing I would like to add before I forget is to ask the person you're working with that you've been referred to, what is your experience with working with patients with traumatic brain injury? If it's zero, this may not be the person you want to work with. Give them a chance, check them out. But if they say stuff that you're not comfortable with, then move on,
Hmm.
find somebody else. But that is the really key question. What is your experience of taking care of patients with brain injuries? And that's how you're going to really find those individuals like me who are passionate about helping patients recover.
Hmm. I feel like communicating with your doctors is the best thing so you can find the best path for you. And that kind of goes back to what you said earlier with each traumatic brain injury is different according to the person. So everybody needs kind of an individualized plan. So just starting with the right person and asking questions can help lead you on the path that's best for yourself and your recovery.
For sure.
And lastly, what do you wish more people knew about traumatic brain injuries?
I wish that people would take them more seriously. I wish that people would not after a fall, stay at home and wait and see. I wish that they would seek care sooner. Um, would like people to understand that sometimes people don't recover in 2 weeks, that this could even possibly extend to a lifelong struggle. I would like them to know that after one head injury, if you have a second impact within 6 months to a year, this can even worsen the symptoms. If you had symptoms from the first impact, it can lead to a slower recovery with the second impact, and over time can increase your risk of dementia. So it's not a one-off thing. It's not like you got a cold and you get better, or you broke your leg and you get better. This could be a lifelong risk throughout your entire life that needs to be discussed at each physical and doctor appointment.
Like you said, you just have to keep track of your symptoms and pay attention. And if something doesn't feel right to yourself, make sure you talk to your healthcare provider about it because you know yourself the best. So if it's a gut feeling that it's just not right, pay attention to it.
And pay attention to your caregiver.
Mm-hmm.
They've got the better working brain at the at the time, and they're going to give you insight into things that you may not have the ability to see at that time. So really pay attention to what they say, and follow their recommendations. I know everyone wants to be better the next day. You want to maintain your independence, and that can be a hard pill to swallow. But hopefully, and over time, it won't be the case. You'll end up being able to rely more and more on your perception and understanding of things around you. But if you don't, ask the person who has the healthy brain that's sitting next to you, hey, what do you think?
Exactly.
What do you think about this?
Great advice, Kelly. Great advice. And that concludes our interview for today. Again, Kelly, thank you so much for joining us and sharing your story. Your knowledge of traumatic brain injuries is both informative and inspiring, and we thank you for the work that you are doing to spread awareness about traumatic brain injuries. Please make sure to check out Kelly's website at kellytuttle.org and her book, After the Crash, which can be purchased on her website and Amazon. And if you're interested in sharing your story with us, please reach out with your name and email address to set up an interview. Email me at powerofpatient@gmail.com. I'm Bri Allison for the National Library of Patient Rights for Advocacy, and thank you for watching.